Hey, good afternoon. Hi, I'm Dr. Josh.
Hi, Dr. Kristina.
Welcome to Crossroads Chiropractic Facebook Live. And today we are going to be talking again about the shoulder again.
Yes.
Yeah. As if you're not tired of the shoulder. Well, we got a lot of great comments and questions from our last video. If you didn't check it out yet, go back, take a look at it.
Yes.
We gave some really fantastic rehabilitative exercises for shoulders. It's the exercises that Dr. Kristina and I both like to give our patients for helping stabilize the shoulder joint, helping it to heal. We did get some comments and questions for someone who's got like frozen shoulder, if they have
like shoulder surgery,
shoulder replacement, those type of scenarios where it's a lot of acute pain. And so you can still do those exercises. We want to recommend that you do it really lightly. No weight at first when you're doing them, just to kind of get the movements. But because we had some questions about pain and post-surgery issues, I thought that this video, Dr. Kristina and I thought it would be a great idea to talk about a great exercise for shoulder pain.
Yes.
It's the one that I give all the time. It's pretty simple. I'm going to explain it, and Dr. Kristina is going to demonstrate it. Does that sound all right?
That's fine.
So one of the problems with the shoulder, when you get inflamed, the shoulder is pretty much a contained. You got to think of it as a joint that's contained in a sac. And when you have any type of injury in it, adhesive capsulitis, frozen shoulder, tears, sprains, strains, any of those things, what happens is you develop inflammation. And that inflammation settles in this fluid-filled sac, right?
Yeah.
And that inflammation is basically stuff that is not so good for your body. Your body doesn't like it, and it hurts. So that's why inflammation hurts, is it pushes pressure on tissues, and it's got noxious chemicals in it that make it not feel so comfortable.
Yeah.
So we want to get rid of it.
Exactly.
So part of this exercise helps just kind of mix things up. It helps your body get rid of the toxic chemicals, helps your body release some of the some of the pressure from the inflammation. Plus, it stretches the proprioceptors and the ligaments.
Yeah.
Anything else with it? That's how I explain it.
That's great. Yeah, it sounds good.
It's very, very effective for shoulder pain. It's the one I give to every person who's got shoulder pain, and it really does work.
Works really great.
So, it's called the Pendulum Exercise. And the reason why it's called the Pendulum Exercise is you want your shoulder to be like a pendulum.
Yeah.
And so you're going to let it freely swing.
Yes.
So, how you do it? Actually, how do you do it, Dr. Kristina? Why don't you show
I'm
everybody?
going to show it. So you're going to want to stabilize yourself. So here the table might be a little bit low.
Yeah.
So you could probably use maybe a chair and hold on to the chair.
Or a table, like
a
a countertop or a table or something like that.
Because you want to keep a neutral spine.
Yeah.
Right? But you're just going to basically let your arm hang. Right? And let the shoulder go against gravity, and then you can just rotate it. What I like to say is just do, move in circles to one way, like to one side. So you're going left circle and then go right circle. Yeah. And then go the other way and do a bunch of circles.
Now, one of the things that I think that the mistakes that most people think when I tell this to them is they want to muscle it. So, for example, they want to physically actively move it as if you're mixing a stick and you're mixing up a cake. Yeah. You do not want any of that muscle engaged. So the key is to try to get all the muscles to relax. So you want it dead. So it's almost like you got your zombie arm, right? And you want your arm completely dead. It's like you've lost all feeling in it.
It's like a noodle.
It's like a noodle. That's good. Noodle arm. Noodle arm.
Like a noodle.
So it's we should call it the Noodle Arm Exercise than the Pendulum Exercise. That makes a lot more sense. Let's do the Noodle Arm Exercise.
The Noodle Arm. And then you just want to start to...
letting it swing forwards, backwards, let it go
swing,
around.
forward, back, side to side. In circles, right?
And it works really, really well. I had one patient, she had bad both shoulders. And so she would walk around the house like this. She's like, Dr. Josh, I feel like a monkey. She would do it going up the stairs because she could kind of hold on to the steps if she had to. So if you got both shoulders, that's an option.
Oh my goodness.
This is one you want to do alone. Don't do it around people because you look ridiculous.
That's it.
Especially if you have both shoulders.
But
make sure you definitely have a spot where you're holding, you're stabilizing it, and you're doing it. So nice and completely relaxed.
Yeah.
Now, how often should we do this, Dr. Kristina?
Every day.
Every day. And for how long, Dr. Kristina?
I would say for like 5-10 minutes.
Yeah. You know what? Honestly, this is one of those exercises where it's not like you're doing reps.
No.
The more you do it, the more you need to do it. You can do it, right? You're not going to hurt yourself if you do more, and if you do less, that's okay too as well. It all depends on how you're feeling. So I have some patients who've got very just twinges. They don't really have major shoulder problems, but what I tell them is to do it when they feel a twinge, or before, like for example, you're going golfing or they're going to do an exercise. You know, you let your arm go nice and loose and swing, and that just kind of just relaxes the muscle so that you got the full range of motion, so that you don't hurt yourself, right? Oftentimes you get some adhesion, you get some tightness, and the body wants to contract around the joint. So it's a good way just to loosen out.
Yeah.
Your shoulders are a funny joint because it's the only joint that doesn't have any the physical bony connection. It's all muscle, right, that holds it in space. So
that's it.
I always explain it, as a golf ball on a tee. That's kind of how I explain it to patients, right? Because it's kind of like sitting there, right? Like it's sitting there and the muscles are holding the golf ball on the tee, right? So if you visualize that can help, understand why we want to keep it moving, right?
Definitely want to keep the motion there.
Absolutely.
Yeah. Fabulous.
Awesome. That's good.
That's it.
So
It's easy, simple.
Very simple, easy. It was a lot of explaining for one simple exercise. So if you like this video, please share it with everybody. If you know someone who's got shoulder problems and all the rest, make sure they watch this video because this is a great one. If you have arthritis, or if you know someone who has arthritis, good exercise for that. Or someone who's had post-injury and they got a little bit of tightness in the shoulder, great exercise for that too as well. So share that with all your friends, family members, your enemies, your frenemies. And check us out on
Instagram.
Yes.
And YouTube.
And
on our website.
Which is?
www.crosschiro.ca.
Awesome. Did you get all that? Awesome. Good job. All right, everybody. So this is Dr. Josh.
And Dr. Kristina.
Thanks for watching, and we will see you guys next week. Keep your questions coming. If you have questions, post them for our next video.
Yes.
We'll let you know.
Bye.
Bye.